Hello, Igniting Community. I'm Doris Forrester, and I'm back with another global population and gender talk. Today's talk is going to focus on COVID-19, and I'm not here to debate any of the mandates, the vaccines, the masks, any of that. I'm not here to talk about what countries did well, what countries didn't do well, and I'm not here to talk about the fact that only women were impacted, because I know other parts of the population were, the elderly, men, and children were impacted. But what I'm going to look at is a vulnerable population already and the impact of this COVID-19. We know that COVID-19 has had a huge impact globally. We're seeing it now with increased inflation. We're seeing it now with supply chain issues, and we will be feeling it for months, maybe even years to come. Food security is going to be a concern. Gas prices are super high. And all of these things are going to have even a greater impact on women. I've looked at previous talks to the Sustainability Development Goals and the gains that have been made for women. Many of those gains are now losses, and the United Nations is saying that they have to start way back. Maybe when they started in 2015, they're back to that position that they were because of all the losses due to COVID-19. So I'm just going to give you a brief kind of run through of how COVID-19 has impacted women. The data is not going to be 100% because we're still in the pandemic, and we haven't seen the total impact that this has had. And I think some of this we won't see fully for years to come. So when we look at the impact, we can look at economic up at the top. I love this visual. I like my data in visual form. It's easier for me to read. So we have economic at the top. We have to the left, we have health and well-being, and to the right, we have the healthcare system itself. So when we look at economic, this is money, this is jobs. This is not only jobs, but also more work that that the woman is burdened with. And then looking at future prospects, if women have lost their jobs, what does the future hold for me and my family? When we look at health and well-being, as hospitals are filling up with COVID patients, what's happening to women's health? What impact does that have? And in the example here is maternal mortality rates are going up. Infant mortality rates could increase as well because of this. And then we look at the other impact when families are struggling financially and there's a lot of pressure at home, an increase in sexual domestic violence and exploitation occurring. When we look at the healthcare system, we have an increased risk of the frontline health workers. The majority of those workers are females, and there is an increased risk. And then we have a reduced access to vital health services. So as the hospitals are filling up with COVID-19, a lot of women are not getting the care that they need. And then I think about in countries where there is not equal, the genders are not equal, and women are struggling for gender equality. If two people come into a hospital, one requiring oxygen, both actually, one female, one male, you've only got one tank, who gets the oxygen? And in many countries it will be the male. Or if a woman comes in about to deliver and there's no room for her, what happens to her? And I'm going to touch upon some of them, not all, because like I said, the data is not complete and we don't know the full impact. But this is the only infographic I could find, and it is from the Latin American countries. This has been put together, this situation. And I'm pretty sure if we looked at Asia, we looked at Europe, we looked at North America, and we looked at Australia and Oceania, we would see similar things. So it goes through healthcare and women at risk. So here in Latin American countries, 9 out of every 10 nurses are female, 5 out of every 10 doctors are. So greater risk of getting sick by treating patients is that on the women. Okay, not only that, but the job of looking after sick family members also is the majority of countries women are doing those jobs. And then we look at economic vulnerabilities, and I'm going to talk about that in a little bit more detail, so I'm just going to skip through that. Unpaid care and domestic work burdens, I'll talk about that as well. Increased violence against women. And then the final one is one of the Sustainability Development Goals, looking at sexual reproductive health. And I already mentioned it, that many of these goals have stopped advancing, and they're actually regressing in what was being achieved. And as countries are recovering worldwide, and we have other things happening other than COVID-19, we have climate change, we have wars going on. As countries are starting to recover, they have to prioritize, and maybe some of these sustainability development goals will not be in the future recovery. So if we look at, here's an example, it's just comparing the economic condition between women in the US and women in India. So you can see that women make up only 46% of the workforce in the United States prior to COVID-19, and they accounted for 43% of industrial job losses because of COVID-19. But what's interesting is look at their unemployment. Of all the jobs lost, 54% of those were jobs that women did. And if we look at India, it's similar. The numbers are a little bit lower because women are not as represented in the formal economy. Most women are working in the informal economy, which is not regulated by the government, and income is not recorded, or they're doing unpaid work. So 20% of the labor force is women in India. 17% of the jobs that were lost in industry were women, jobs that women did, and 23% of overall job losses were that to women. So it's actually more women who lost their jobs than women were working, percentage-wise. And they're saying that the job losses were due to the nature of work across industries and across countries. There's certain jobs that women do more than males. And it's just women tend to, no, not women, but women and men tend to cluster in different occupations. And the occupations that were hit the hardest were in industries that are done predominantly by women. The retail, the hospitality, tourist, education. And in certain countries, if you don't work, you don't get paid. I know where I worked, and we worked from home, and we were shut down for a couple of weeks. I still got paid. In other countries, maybe not so fortunate. So what the estimate has been is that during COVID-19, 4.5% of women employment was at risk versus 3.8% for males. So that is a significant difference. And I really like this visual because it shows male-dominated jobs that were less impacted and more impacted versus female-dominated jobs that were impacted more and impacted less by COVID. You'll look at healthcare and social work. That actually saw job gains. So if you look at the bottom, share of jobs impacted versus women's share, because of the nature of that pandemic, right? It was healthcare, and we needed our nurses working, and our healthcare workers and our social workers. The other jobs, accommodation and food, that was huge. Tourist countries that were so dependent on tourism almost had complete collapse of their economies, and they were so desperate to get people to come back, they had to kind of not report their COVID numbers. Education, not so bad, but then we have retail was a big one. Okay, and in terms of males, you can see the construction jobs, but they're teetering like on zero, where we had this like a negative 30. And then when we look at, we just look at women's work as at a glance, we know that they tend to earn less. This is globally. They have fewer savings because they earn less money. They make up the greater proportion of single parent households, and that's probably why they make a little bit less money, and they have fewer savings. They can't do the overtime that perhaps males that are in a family with a wife, and the wife is looking after the household. They have less access to social protection because many of them are not working in the formal economy. And they are also burdened with the unpaid work of looking after family. And so some of them may have had to stop working during COVID to look after their children when schools were closed, for example. Okay, so when we look at this visual, we can see that poverty gaps between men and women. So there were estimated to be 195, this is according to the United Nations, million men that were living in poverty before COVID. That number increased to 221 million during COVID. And then when we look at women, already we have more women living in poverty, 206 million. That increased to 232 million is what they're saying, living in poverty. And so, again, as countries are recovering their economies, where are they going to put their priorities? Is it going to be getting people out of poverty? I don't know. Or building their economy? I'm not sure what it'll be. So in looking at this infographic, we can see that women spend 3 times more, as many hours as men, working in the unpaid domestic kind of work, looking after the family, even driving kids to sporting events and that sort of thing. If we look globally at the percentage of the workforce, we have 94% being male, 63 are females between the ages of 25 and 54 that are in the labor force. So out of that age group, 94% of males are working versus our 63% females. We have the gender gap, and 740 million women working in the informal economy with less protections. And just looking at the bank accounts, if, you know, COVID-19 has got you to a point where you need some financial assistance and you don't have a bank account, our bank's likely to give you money, and it puts women more at risk. Here we're looking at the comparison here. It's just Spain and Italy, and we're looking at female healthcare versus male healthcare workers infected, and we see a 72% for female, 28% rate for males, and in the case of Italy it's 66% and 34%. So you can see the impact there. Here we're just looking at unpaid and domestic work and how much women do, and that burden was even magnified even more during COVID, right? So this one is like, on average, they're saying women spend 4.1 hours of their day doing unpaid domestic work, and men spend 1.7. During COVID, that would have increased even more because children were at home. Okay, so unpaid contributions to healthcare, what percentage of women actually do? And that's equivalent to $1.5 trillion. And this is women's contribution to all types of care, not just healthcare. So looking after elderly, looking after children, it equates to $11 trillion. And that's not reflected in the money that they make. Another impact of COVID-19 is the increase in violence against women. So they're saying globally 243 million women and girls between the ages of 15 and 49 have been subjected to sexual and or physical violence perpetrated by an intimate partner during COVID, and that has increased. I mean, you can see the examples here of countries that have made some reports. And again, the numbers are probably very, very low. And I always have to have a map. So I like these maps because it shows examples from all the continents and all types of development. So we're looking at this one. Women did more unpaid work before COVID. How much more time women spent on unpaid care work and chores than men before COVID. And that has increased. And this is a proportion of women who say they are spending even more time on domestic chores, and the increase that, or the percentage of women that are saying that they've actually had to do more. And you can see Mexico, 48%, Turkey, 89%, Afghanistan, 77%. So they were already doing so much more than men in many countries, and then the burden of COVID just added to that. Okay, and so that is all that I have. I just wanted to raise a little bit of awareness, and I don't think that the full numbers are out yet. Maybe I'll do like an update to this when more numbers come out. In June, I will look at all the sustainability development goals that relate to women and look at, take a snapshot at 2020, I think I have it for, of how women are doing. But next month will be human trafficking, so stay tuned. Have a great day. Be kind. The world needs it. Ciao for now.